I would say that today in medical diagnosis, most of the diagnosis, say 75%, depends on pathology testing. So be very careful in choosing your pathology service provider. Don't go for the lowest pricing, but go for quality and good people who have the necessary accreditations or qualified MD pathologist.
Welcome to 16th episode of Arogyam Katta. Today we have with us none other than Dr. Avinash Phadke, who is credited with starting a chain of medical laboratories across India. He has a laboratory which was running successfully for decades. However, he opted to go in for a chain of medical laboratories. Now, Dr. Phadke, of course, we will not every time call or chain of pathological laboratories. For the sake of convenience, we'll call a chain of laboratories. And thank you for coming on the Arogyam Katta and ready to be a part of to answer the questions that normally a patients have in their mind. See, you were running a laboratory very successfully because Phadke laboratory was known, very well known for years together. I think your father started and
Yes.
okay, now when you took over, also it was doing wonderfully well. How did you get an idea of starting a chain of laboratories instead of standalone one laboratory which you were running?
Yeah, very interesting question, Prakash. I think I will just give you background. The laboratory was started by my father, late Dr. A.M. Phadke, in 1965. I did my post-graduation from Tata Cancer Hospital and joined in 1980. So by the time we reached 2000, the laboratory, like you rightly said, was a reasonably successful mid-sized proprietary concern. We were having a staff of about 100 people at that time. And the reason I started realizing that there was advent of various new technologies in pathology. There were decades, like decade between 1950 to 1975, where nothing happened in pathology. Pathologists could practice with a microscope and a calorimeter, and that didn't change.
Correct.
And then came the time of rapid change. There were batch analyzers, random access analyzers, then there was advent of molecular pathology. In cancer diagnosis, there was immunohistochemistry. In other words, we were migrating not only towards newer technologies, more test menu, but more capital intensive technologies.
Okay.
And that was the reason that in 2001, I felt need that on a standalone basis, I will not be able to have the best possible equipment which is mandatory in today's time. And that is when we formed a joint venture with Mr. Ajay Piramal that time.
Okay.
And that was called Piramal Diagnostic Dr. Phadke's Path Lab. He was the chairman of that venture and I was the managing director.
Okay.
And incidentally, this was the first private lab in India to opt in for NABL accreditation in 2002.
Okay.
So our accreditation number is first in the private
laboratories.
space.
Okay. Great.
Yeah. So that is the background. So the main need for us as a proprietor was a restriction of capital, which I didn't have. Apart from that, I think I learned a lot during this partnership because as a proprietor, we didn't have knowledge about finance, procurement, logistics, supply chain, commercial negotiations with different vendors. So that expertise, which was non-medical, was brought in by Mr. Piramal's team.
Okay.
And from one lab in 2002, by the time Mr. Piramal decided to move on from this line in 2010, we were employing about 1,200 people and had about 35 pathology labs and about 7 to 8 MRI and CT scans.
I see. So you are not restricted to laboratories. You are
So
into
that time it was a mix of laboratories and
diagnostics.
this thing, though laboratory was forming almost 80-85% of the revenue. But later on we realized that the high-end imaging is very, very capital intensive and manpower specific. So as we are in 2024-25, the current company's name, which was formerly SRL Diagnostic Dr. Phadke, is now changed to Agilus Diagnostic Dr. Phadke. And currently our radiology is limited to very few high-end radiology setup. And you can say, as things stands, the radiology contribution is hardly 5 to 7% to total revenue.
What does AGL stands for? I mean,
Agilus is
how do you spell it? How do you?
Agilus.
Okay.
It comes from the word agile, means alert, responsive. It's a Latin word. But the difficulty which you express that the brand name recognition is not so strong like SRL was. So to overcome this challenge, the company has engaged in a public campaign with Anil Kapoor as a brand ambassador. So we have a lot of FM coverage and bus stop coverage and World Cup coverage, which is advertising the brand Agilus, because it is not as popularly accepted as SRL brand.
Correct.
And now, at least in most of the country, Agilus brand name is fairly
acceptable. Okay. Now, as a patient, what's the advantage of going to a chain of what do you call it? Chain of laboratories, or how do we?
So we can call it as a chain of laboratories. Now, most of these laboratories are in listed commercial place. Means they are listed on the stock exchanges. So we are listed through listing of Fortis, which currently is the majority owner of Agilus Diagnostics. Similarly, Metropolis, Vijaya Diagnostics, Krishna Diagnostic, Dr. Lal Path Lab, Thyrocare, all these are now listed companies. So when you ask about chain laboratories, essentially what it means is there is certain uniformity of the equipment, the minimum required manpower. The test menu is very large compared to a normal individual proprietor concern. Apart from equipment constraint of putting in the money, the real constraint is the talent pool which is required in a multidisciplinary pathology environment today. For example, an MD pathologist may not be qualified to opine on cancer pathology or molecular pathology or cytogenetics or microbiology or high performance liquid chromatography based tests, so LCMS technology. So all these technology require expertise from different people. And that expertise is available with these chain labs because of the scale involved, they are able to employ right from hematologists to molecular pathologists, cytogenetics, from who does bone marrow workup to various other branches of pathology. So pathology today is not one branch. So within pathology there are at least 10 to 12 different branches now.
Now tell me, it is easy if you have a lab to control the quality or ensure consistency of results. In a chain laboratories, how do you ensure that the accuracy of results or the consistency of results are guaranteed to people?
Yeah. So see, out of your total number of labs, in our case, at least 40 to 50 labs are NABL certified. Some are having entry level NABL, that is another 15-20 labs, but the common platform is the external quality control program, which the chain lab engages into, is common to all labs, irrespective whether they have accreditation or not. They have to mandatorily pass those criteria.
Okay.
And this is a real-time information. Means whatever QC they have done in the morning is available to us on day-to-day basis.
That's online, like
Online.
like online.
So they are supposed to do internal QC and external QC on daily basis and upload it. So the compliance officer or a quality manager sitting in Mumbai or Delhi on real-time basis knows that what is happening in each lab. Now, this is easy in immunochemistry, immunoassays, and biochemistry. It becomes difficult in certain areas of pathology which involve microscopy. For example, if it's a microbiology setup, then the standardization is little more difficult than the remaining parts of pathology.
Now, for a patient, his data or result privacy or data privacy is very important. Even in general, there's a lot of talk about data privacy and integrity of data. Now, when you have a chain of laboratories, when samples are handed over at multiple levels, multiple locations, multiple places, how do you ensure the patient's safety and patient's data privacy?
So, very interesting question. And as you know, in today's times, no pathology diagnostic chain can run without a very robust IT program.
Correct.
And that has become a backbone of running a pathology lab, not only because of the confidentiality issue which you maintain. So we have to be compliant to various international security, online security norms, and without that, we have, say, College of American Pathologists
CAP,
accreditation, which is called CAP accreditation, or NABL, which also is affiliated to various international bodies. So unless we are compliant, we are not. It's not possible for us to achieve those accreditation. So it's a minimum requirement. But more than that, I will also say that we don't realize that most of our equipment in the lab. So, for example, there are at least 120 to 130 different types of equipment in each lab.
In each lab.
At least in reference lab. In a smaller lab, there could be 30 to 40 different types of equipment. In a reference lab, it could be about 150. All these equipments are bidirectionally interfaced with the software. So in other words, suppose we collect your blood sample, to give you an example. It will have a unique barcode. On the basis of that unique barcode, once we put it in track system, it goes, the primary tube goes into all machines. The results are automatically
not as a Gadgil PP.
Not as a Gadgil PP, depending on the mask name. On the basis of unique barcode ID, which will enable the machine to identify which test to be performed on you. And since it is bidirectionally interface, the machine will in turn communicate with that unique ID, which is automatically auto-mailed to you on your mail ID which you have provided. And sometimes you will get it on your WhatsApp with a enabler where there is either a OTP or a unique ID which is end of your mobile number or some such thing which is unique to you, which only you will be able to access.
Okay.
So this is generally, you will see this across the chain lab. Unfortunately, in India, we even today, out of total 1,20,000 pathology labs exist.
How much?
1,20,000, out of which 20,000 are manned by MD pathologists, and about 2,500 are NABL certified.
I see.
So if you see the number of NABL compliant labs, it is not even 0.1% of the total lab population in the country. Thankfully, NABL has introduced now entry-level accreditation, and hopefully even the small labs will become part of this journey and move towards having certain minimum quality standards in place.
No, that's correct. But what happens is all these NABL, NABH, CAP, I don't know. But all of them are compliant on a particular day. It doesn't guarantee the consistency. Consistency is guaranteed by the people who are behind the
Absolutely.
chain. So the credibility of the people who runs the lab is more important than the accreditation, in my opinion. How do you react to that?
No, I fully agree with you. In fact, that is one of the disconnect which always a medical professional has with a business person, whether he is a CEO or a promoter. That disconnect always remains because sometimes there is a thought process that you can run pathology lab without a pathologist. Now, luckily for us, there is a Supreme Court guideline that each report has to be signed by MD pathologist. So even if a PhD doctor signs it, there has to be a counter signature
Counter.
by a MD pathologist today. If it's done by a DMLT lab, he requires a MD pathologist doctor, and no MD pathologist is allowed to supervise more than certain number of labs. So that means it's a legal requirement today to man your labs by an MD pathologist. That's part one. Secondly, for the patient, giving instructions about the test, explaining the reports of the test, and overseeing day-to-day performance of the lab. If there is a MD pathologist available in that lab, that gives a lot of confidence and comfort to the patient. Most patients would like to know more about their reports when they come in the evening to collect the report. Even if they have received it online, they want to have some personal interaction because they have lots of questions about their
Correct.
reports. In sometimes the common example that the fasting post lunch disconnect. That means in many patients who are on anti-diabetic treatment, they know what I am talking about. The fasting blood sugar is higher than the post lunch. Now, this could be because of medication, it could be because of dawn phenomena, it could be also because of a high carbohydrate meal previous night. So these things are explained by the pathologist. Otherwise, the patient starts questioning the credibility that how my post lunch can be lower than my fasting blood sugar.
In fact, I was to come on that normally in a standalone laboratory, there is some human being to talk to about the analysis of reports or whatever. Obviously, the treating doctor is the best person to do the analysis.
Absolutely.
But nevertheless, to stop that anxiety, that is it so bad or is it so good? Okay, there has to be a human being in the laboratory. There is a standalone laboratory. There is a person. Now, in a chain of laboratories like non-faced or unfaced place, how do you deal with such issue?
No, as I explained to you, in our laboratories, we have about 140 hospital-based labs and about 350 to 400 standalone labs. And every single location there is a MD pathologist for the same reason which you mentioned. And though you said that finally the best judge is the referring doctor, now what has happened that the pathology test menu has increased from basic 300 tests to about 3000 tests.
Oh.
So even a physician may not be aware as to what tests have become available in his domain. Because every year there would be so many new tests which are
introduced.
Just to give you an example, there is a molecular test called biofire identification of various pathogens. Now, this test, suppose somebody has meningitis. Earlier, we had no way of knowing whether it is pyogenic, which is the organism, or it is herpes, or it is cryptococcal meningitis. So, we used to go by cell count, what is the percentage of polymorphs and lymphocytes and protein content. Now that CSF is subjected to biofire analysis, and within 1 hour, we are able to tell that out of 20 pathogens, which is the pathogen in that particular
one.
So it becomes a very life-saving piece of information. So it has revolutionized the way the pathology diagnosis is done. And today, a modern day clinician in 75% of cases is dependent on pathology for final diagnosis.
See, earlier, again, I'm comparing earlier and this thing. Consultant or a GP or family physician or someone who will prescribe some test. I would go to a laboratory. he would charge me for the test that have been asked, and by evening or by scheduled time I'll get the report. Today we see even on Facebook or every media, it's only on package. Everything has come on a package. Diabetic package, wellness package, this package, that package. Now, how is that migration helping patients to reduce cost, or it's to increase the cost of diagnostics?
So this is a very important question, and there are two sides to it. First of all, whether it helps the patient, yes. Whether it helps to every patient, the answer is no. So you have to judiciously make use of packages. There is no one size fit for all in this case. Suppose you are a diabetic, and let's say you are doing only fasting blood sugar and post-lunch blood sugar, you are glyco-HB, and you are happy with that. But as you know, diabetes is a multi-organ involved. So you don't know your creatinine levels, you don't know your microalbumin create ratio in the urine, which is the earliest sign of anything going wrong in your kidneys, for example. You don't know your heart cholesterol risk or various other parameters, say C-reactive protein risk. So you don't have any idea about the overall risk to the diabetic patient, and that is not revealed by sugar control. Diabetic is a metabolic disturbance which involves multiple organs and multiple types of disorders. Sugar is just one manifestation which we are able to measure. So unless we have a package, the patient is not wiser. For example, I would go to an extent and say that only package also may not be sufficient because it doesn't cover his eye checkup. It doesn't cover his foot checkup. It doesn't cover fatty liver, so he needs an ultrasound examination. So you need various modality to assess the overall disease burden in that particular patient because of a particular disease. And that's why these packages have started becoming more and more popular and prevalent. In some cases, in healthy population, suppose somebody is healthy, all tests are normal. In that case, he shouldn't do it at least for a year more. So that has to be kept in mind that if everything is absolutely fine and he is a young adult, he can do it every 2 years. There is no need to go on repeating it just for the sake of that. But if there is something which has come positive, depending on the severity of it, we need to undergo a variety of other tests.
I see nowadays reports showing if I come to a particular laboratory thrice or 4 times or 5 times, they give me a record of my first test onwards to fifth test. But that normally makes the report 10 pages, 12 pages. Now the doctors hate these kind of things. When we take it to a doctor, he says, "Arey baap re, itna sab page dekhna hai." Now, how do you address this issue?
Yes, it's true. I have seen many doctors even don't like digital reports.
Correct.
So if you show them on your WhatsApp,
oh my goodness,
or if you show them on mail,
they
hate
virtually
to
throw
see
you
it.
to
I know a couple of senior doctors who say, "You please take a printout and
break down,"
because they want to have a look at the report in print. Now, I will give you an example. There is a hypertension patient who is also having microalbuminuria. That means there is a protein leakage in the urine. Now he is put on what is called as ACE inhibitor or ARB drugs to control his hypertension and also to protect his kidneys. Now, because his blood pressure has come down and because he is using ACE inhibitors and ARBs, his creatinine is actually going to go up. That doesn't mean the disease has progressed. It just means his pressure is better controlled and his intraglomerular pressure, that is pressure in the kidney, is better controlled, and it's a hemodynamic change. It's not a disease which has become worse. But when he sees this trend, he sees his create, which was 0.8, suddenly has become 1.1. So without background of what medication he has started, if somebody is having blood pressure of 160 and 100, his create was 0.9, just the act of blood pressure control itself will raise the creatinine.
Okay.
That is because it was operating at a high pressure on a high GFR, which would have eventually damaged kidney. Now, because we have lowered the pressure, the filtration is also reduced.
Is reduced.
So the creatinine goes up as a corollary to that.
Correct.
That doesn't mean his kidneys have become worse. But this is true within certain range. For example, these fluctuations should be not more than 10-20% of the total value.
Okay.
Anything beyond that, then of course he needs to consult his physician. So that's why the trend line becomes very important. So somebody's glyco-HB, if it was 7.8 and that suddenly starts going to 6, then we know whether we are over treating this patient, and if you are using sulfonylurea drugs, he could be having periods of hypoglycemia.
Okay.
Because this tells us that his glyco-HB is going to below diabetic range also. So these become very important, but I agree with you, many doctors don't want to go through so much of typed reports also.
Anyway, I think the way the things are, standalone laboratories are almost diminishing. Many of them are closing down, or there's no succession plan, or whatever. Future is the chain of medical laboratories or diagnostic centers. Now, the problem always the people of older generation is these all work on a very high-tech softwares or a very high-tech apps, which people like me who don't know how to operate apps. Now we want somebody to talk to. Now, do you have a facility of someone to talk to?
Yes, this MD pathologist is a full-time MD pathologist, so he is available in that particular lab for the whole day. But I will tell you one thing, if we have impression that most of the labs are now under so-called chain laboratories, even today the total market share of chain laboratories in the existing diagnostic space in pathology is not more than 20%.
Oh, I see.
So 80% of the
Are still with retail,
are still with regional players or their individual standalone lab. And I must compliment these people because even in today's times, they are investing their time, energy, and they are serving a population where the others are not able to reach or are not willing to go. So I think they play a very important role as facilitators and to a large section of population. So I am always supportive of these individual initiatives also. We don't treat them as competitors, or if we are treating them as competitors, some people are, it's wrong, because they are playing a very vital role in today's diagnostic environment. Yes.
Now, we'll be asking few rapid fire round questions and make few statements also, and would request you to tell us whether it's true or false. Your lab provides online test reports?
Yes.
Weekend lab services are available?
Yes, they are available.
Home sample collection is an option for patient?
Yes, that's an option.
Is it free?
It is not free, unfortunately.
A centralized number is accessible for all the branches?
Yes.
Automatic reminders are sent for follow-ups?
Yes.
Are your rates most competitive in the market?
I would say we are in the mid-range. We are not very high, but we are not the lowest in the market. There are other lab chains who are even at a lower price point, and there are many others who are at same or higher price point. So we are not at the lowest end of the market.
Are all tests done in every laboratory?
No, I would say we have a 3000 test menu. So majority of the labs would undertake only 3 to 500 test menu. The remaining are sent to what we call as a reference lab, which is a centralized large lab. So in Mumbai, we have it in Goregaon and Mahim, where they would be referred to.
Patients can expect uniform pricing?
Within the city, yes, but it is not same across India. It would vary from state to state.
Test formats are uniform?
Yes.
Senior citizens receive a special discounts.
Yes.
A quality control protocol is enforced at every laboratory.
Yeah, strictly so.
Does all laboratories work 24/7?
No. I would say out of our total about 430 labs, about only one third would be working day and night. The remaining work from 7:30 to evening 8 p.m.
8 p.m.
and they are not available 24/7.
Patient satisfaction surveys are conducted periodically.
Yes, very regular.
Fast track testing is available for urgent cases.
Yes, available for all urgent.
Is it at a premium or a same rate?
No, it is at the same rate.
The labs work with hospitals for patient reference.
Yes.
Patients can get second opinion within the lab chain.
Yes.
That means, can I challenge and say, okay, please, I want a test to be done in the other laboratory.
Yes.
I doubt your results.
That is available within the group laboratory.
Within the group laboratory. Teleconsultation services are available.
Yes.
Health packages covering multiple tests are offered.
Yes.
Are you present across the globe?
No, we are not present across the globe.
Are you present in certain specific foreign countries?
Yes, in very few foreign countries, like in Dubai, we are there in Nepal, we are there in Sri Lanka, and few more.
Are all labs certified by NABL, NABH, or whatever standards?
No. Only one third of our labs are certified by NABL. The remaining undergo the same quality control protocol, but they are not certified by NABL.
Are all labs disabled enabled?
No.
Thank you for answering all the questions. Anything you want to add from your side for patients?
I would say that today in medical diagnosis, most of the diagnosis, say 75%, depends on pathology testing. So be very careful in choosing your pathology service provider. Don't go for the lowest pricing, but go for quality and good people who have the necessary accreditations or qualified MD pathologist.
That gives me a birth to a question. As a patient, how do I know which is a good lab or a bad lab?
See, the basic requirement is to have a MD pathologist within this thing, because there are many labs which are not managed by MD pathologists, or not only not managed, they don't have access to MD pathologists, and that is very not only a legal requirement, but from patient safety point of view, that's a requirement. So I would say, if not accreditation, which is displayed on the board, at least patient should make certain that the qualified MD pathologist is manning that particular lab.
So thank you for coming on the Arogyam Katta, and let's hope that your chain grows multifold, becomes more patient oriented, and patient education also is improved a little further. So thank you for coming on the Arogyam Katta once again.
Thank you so much, Prakash, for inviting me, and it was a very interactive session, and I could see that there are so many questions. I really enjoyed having this interaction. Thank you so much.
Thank you. See you then.
अगर आपको ये वीडियो पसंद आया हो तो चैनल को सब्सक्राइब करें और लाइक करना ना भूलें। अगर आप किसी विषय पर और जानकारी चाहते हैं तो कमेंट में लिखें ताकि हम आपकी पसंद की वीडियो बना सकें।